Problem solving. What is problem solving and why is it important in therapy? Problem solving techniques generally involve a process by which an individual attempts to identify effective means of coping with problems of everyday living. This often involves a set of steps for analyzing a problem, identifying options for coping, evaluating the options, deciding upon a plan, and developing strategies for implementing the plan. Problem-solving strategies can be used with a wide range of problems, including depression, anxiety, anger and aggression, stress management, coping with medical illness, addiction, and relationship or family difficulties. Problem-solving techniques teach skills that aid the patient in feeling increased control over life issues that previously felt overwhelming or unmanageable. In this manner, problem-solving can help with practical problem resolution as well as emotion-focused coping. Problem-solving therapy, PST. In problem-solving therapy, it is important that you first educate the patient about the problem-solving strategies that will be used during sessions. To enable the patient to use the strategies after therapy ends, teach him or her to carefully examine a problem, create a list of solutions, and make decisions about which strategies are appropriate for a variety of problems. Strategies for effective problem solving. The SOLVE technique helps guide you through the steps that most effectively identify and solve problems in your life. S. Selecting a problem the patient would like to solve. Ask the patient to think about situations when he or she feels distress or difficulty problem solving. If planning does not seem to be possible, suggest a different therapeutic technique. The decision to remain with problem solving or move to a different skill is likely dependent on you to direct. O. Opening your mind to all solutions. Here it is important to be as broad as possible. You are encouraged to work with patients to brainstorm all possible solutions. Writing may be particularly helpful for some patients. Even ideas that seem ridiculous at first may generate realistic solutions. For example, Bertha's family would often drop by several times a week without calling beforehand and expect her to care for their children. She enjoyed this, but felt tired many times and was beginning to get concerned about her ability to continue child-sitting at such a frequent pace. Her first idea was to tell them she could no longer babysit. Although she did not like this idea, it led her to consider related ideas such as telling them they had to call beforehand to make sure she felt up to the task. L. Listing the potential pros and cons of each potential solution. Often, writing options along with listing pros and cons can be helpful in considering potential options. Writing allows additional thought as well as a visual image of options. Recommended that patients consider solutions in a logical manner, thus reducing the time spent ruminating. It may also help to identify additional thoughts that might benefit from changes using the techniques such as changing thoughts. In some cases, identification of pros and cons may require obtaining information from other people such as lawyers or financial advisors. V. Verifying the best solution. Examine the pros and cons of the solutions listed. Patients may wish to rank order the solutions based on which solutions are most practical and or desirable. E. Enacting the plan. Identify the steps needed to carry out the solution selected. Patients may need to break actions down into steps small enough to facilitate achievements of goals. Once you and the patient finish formulating a specific plan, encourage the patient to carry it out. D. Deciding if the plan worked. Follow up with the patient to see how well the chosen solution actually worked. If the solution was effective, give positive reinforcement. If the solution was not effective, return to the first step in the SOLVE technique to specify a new problem, or move to O or L to identify other goals or potential solutions for the same problem. The decision to move back and to which step is largely up to you, who might now have additional information about pros and cons and possible solutions. Relaxation. What are relaxation techniques and why are they important? Relaxation techniques consist of a collection of psychotherapeutic techniques designed to reduce tension, stress, worry, and/or anxiety. Relaxation techniques vary in their focus and can be selected based on presenting difficulties as well as patient preferences. Some patients respond to physical procedures, for example, muscle relaxation and/or deep breathing, while others respond favorably to guided imagery. Relaxation techniques are important for brief therapy for several reasons. First, they focus on skills that alleviate stress, anxiety, worry, and tension that are often debilitating and interfere with patient functioning. Second, stress, anxiety, worry, and tension are often very uncomfortable for patients, and providing help to alleviate their stress can go a long way towards increasing positive treatment expectations and rapport. Relaxation techniques are easily conveyed as a method of increasing control and often do not include a direct discussion of mental health difficulties, which can be important for some patients who are concerned about mental health stigma. For these reasons, it is often advantageous to teach these techniques early in treatment to give patients an easy-to-learn yet highly effective skill set. Progressive muscle relaxation, PMR. PMR consists of learning how to tense and then relax various groups of muscles all through the body in a sequential fashion, while paying close attention to the feelings associated with both tension and relaxation. Although muscle relaxation has been found for many years, it has become more popular recently for dealing with different anxiety and panic disorders. With this procedure, the patient learns how to relax and how to recognize and pinpoint tension and relaxation in the body to identify tension and reduce its influence before each reaches high levels or impairment. In teaching patients muscle relaxation, you should first explain the reason for using muscle relaxation and how it will benefit the patient rationale. You should also give a full explanation and demonstration of how it is done. Step number 1. PMR increases control. Introduce progressive muscle relaxation principles and procedures. PMR begins by letting the patient know that he or she can create sensations of relaxation, and that this process of including relaxation begins by being able to identify and discriminate between sensations of tension and relaxation. Step number 2. Note the incongruence of tension and relaxation. Inform the patient that sensations of tension and relaxation cannot occur at the same time. No muscles in the body can be tensed and relaxed at the same time. This principle is other tips to increase stress management effectiveness include having the patient loosen tight clothing or remove glasses, having the patient sit in a comfortable fashion, dimming the lights or removing bright sunshine from the room, having the patient close his or her eyes. Asking the patient whether he or she needs a bathroom break before starting, asking the patient to clear the mind and focus on your voice and instructions 75 critical, and you should ensure that patients fully understand how this applies to their current difficulties. Step number 3. Identifying states of tension. Explain to the patient that tension often builds gradually without conscious awareness. Learning to detect the initial signs of an increase is an important step towards avoiding a full-blown occurrence of tension. Inform the patient that no matter the level of intensity, he or she can stop and reverse the tension using knowledge of PMR. In a sense, it is never too late to reduce tension. Over time, patients become increasingly skilled at identifying stress earlier and earlier. Step number 4. Tense muscle groups. Progressive muscle relaxation asks the patient to tense and release different muscle groups in sequence, moving from the arms to the face, neck, chest and shoulders, torso and legs. For each specific muscle group, it's important to try to tense only that muscle group during the tensing part of the exercise. Throughout the procedure, it is important to concentrate on the sensations produced by the different exercises. Asking the patient to describe bodily sensations is very important for the learning process. Statements or phrases from you might include, "What are you noticing about your body right now?" These questions help the patient to focus on the way the body feels when tense and relaxed. Tensing instructions. Model each tension procedure. Ask the patient to practice and provide feedback. Check to be sure that the patient can identify tension in each group before moving on to the next. Dominant arm. Make a fist and tense biceps. Pull wrist upward while pushing elbow down against the arm of chair or bed. Non-dominant arm. Same as before. Forehand, lower cheeks and jaw. Lift eyebrows as high as possible, bite teeth together and pull corners of mouth tightly. Neck and throat. Pull chin down towards chest. At the same time, try to prevent it from actually touching the chest. Counterpose muscles in front part of neck against those in the back part of neck, shoulders, chest, and upper back or abdomen. Take a deep breath and hold it. At the same time, pull the shoulder blades back and together, trying to make them touch. Try to keep your arms as relaxed as possible while tensing this muscle group. At the same time, make the stomach hard by pressing it out as if someone were going to hit you in the stomach. Dominant leg. Lift foot off the floor and push down on the chair with thigh. Non-dominant leg, same as before. Step number 5. Debrief after the exercise. After relaxation training, question the patient about his or her reaction to the muscle relaxation exercise. It is also important to make any adjustments needed to the training. Monitor any pain the patient experienced to adapt and improve the technique for the individual patient's needs. Step number 6. Continue to practice outside session. It will be important for the patient to practice PMR at least once a day over the first week or two to build skills and confidence. As he or she becomes increasingly skilled at PMR, he or she might find it possible to relax without having to actively tense the muscles. The patient should use regularly scheduled homework to practice in a non-distracting environment. When he or she has learned to relax in a calm environment, it should be easier to relax in a more distracting situations whenever he or she notices tension developing. Deep breathing technique. Another psychological-based relaxation technique is deep breathing. Deep breathing focuses on reducing rapid and shallow, ineffective breathing that often occurs during periods of stress, worry, or anxiety. Rapid and shallow breaths can lead the patient to have decreased oxygen in the system, which can cause hyperventilation, dizziness, lightheadedness, or decreased ability to concentrate. Alternatively, taking a deep, full breath can produce a feeling of calmness or slowing by increasing oxygen-rich blood flow. By asking the patient to attend to breathing and changing the rate and way he or she breathes, you enable him or her to be able to feel more relaxed and function more rich blood, as well as the mind. It can also strengthen muscles in the chest and stomach, which can make it easier to breathe on a daily basis. Steps to deep breathing. Step number 1. Introduce the patient to deep breathing. Indicate why deep breathing was chosen and provide an overview of the procedures and potential benefits. Step number 2. Ask the patient to put one hand on the abdomen with the little finger about 1 inch above the navel and to place one hand on the chest. Step number 3. Ask the patient to pay attention to his or her breathing and ask him or her to tell you which hand is doing more of the moving. Ideally, the hand on the abdomen should be moving, while the hand over the chest remains still. This ensures that the breaths are deep. Step number 4. Work with the patient to take deeper breaths by getting the hand over the stomach to move while having little movement on the hand over the chest. Inform the patient your hand on your diaphragm should move as you inhale in as you exhale. Step number 5. Ask the patient to continue slow, even deep breaths. To pace the patient, you might suggest that he or she say the words in and out slowly while taking breaths. Inhalations and exhalations should build to approximately 3 seconds in duration. Inhalations and exhalations should build to approximately 3 seconds in duration. Step number 6. Ask the patient if he or she notices any changes in breathing and feelings of relaxation. Ask for general feedback about the technique. Step number 7. Repeat the breathing exercise 3 or more times until the patient reports skill understanding and benefit. Imagery. Imagery is a non-psychological cognitive relaxation technique that can be used to ease stress and promote an overall sense of well-being. Imagery focuses on increasing cognitive, emotional, and physical control by changing the focus of an individual's thoughts. We all have daydreamed about pleasant things that have distracted us and made us feel better. Imagery uses much the same process but encourages positive adapting dreaming that distracts or relaxes the individual. Imagery is highly effective for depression and anxiety, as well as specific situations that require clarity, focus, distraction, or feelings of mastery. How guided imagery works. Research has shown that the mind can actually affect how the body functions. It seems the body may not know the difference between an actual event and a thought. Guided imagery uses the power of the brain, images and the perception that you are either somewhere else or in a different state of mind, to increase pleasant experiences and performance to promote wellness and health. On the flip side, imagery helps to reduce stress, tension, and anxiety by changing thoughts and emotions or through distraction. Imagery is commonly referred as a guided imagery. Guided imagery refers to a process whereby you facilitate or guide the initial images the patient uses. The following section describes how you can guide the patient into the effective use of imagery for relaxation or performance improvement. Step number 1. Introduce imagery. Introduce imagery to the patient, pointing out the power of the brain or thoughts and how images, when accessed correctly, can actually change physical and emotional states. Identify the desired outcomes, such as decreased anxiety, increased focus, distraction. Step number 3. Develop an image or scene. Work with the patient on the third step to identify a situation, either in the past or a place he or she would like to be, that both you and the patient feel might benefit or produce the desired outcome. Sample imagery scripts are provided below and can be used if the patient has difficulty creating a personal situation. Selection of a powerful image is critical to the success of this technique. Selection of an image that the patient is able to fully embrace increases the odds of treatment success. Selection of a weak image, for example, not viewed as important by the patient or unable to be fully visualized, will likely lead to treatment failure. Step number 4. Increase vividness of the image. To ensure that patients find a strong image, ask them to explore as many senses as possible to increase vividness of the image. For example, when imagining a glass of lemonade, imagine holding a glass that feels icy and cold, visualize the color of the lemonade, think of the fresh citrus smell, and finally think of how the lemonade tastes. This is an example of imagery that uses multiple senses and increases vividness of the image. Increasing vividness is largely a matter of increasing the details the patient experiences. The more details described by the patient, the more powerful the technique. Step number 5. Ask the patient if he or she notices any changes after the imagery exercises. Ask for general feedback about the technique. Step number 6. Repeat the imagery exercise until the patient reports skill, understanding, and benefit. Step number 7. Ask the patient to identify situations when imagery might be appropriate. Expand upon the patient's responses by adding other situations like how the technique can be used. Step number 8. Continue practice outside session. Work with the patient to set a homework assignment that encourages application of imagery to situations when the patient feels stressed or feels that imagery might be beneficial. Imagery, example scripts or guides for therapists. Script number 1. Generic example. Once your whole body feels relaxed, travel to your favorite place. It can be any time period or any place. This place is calm and safe. There are no worries here. Look around this place. What do you see? Do you hear the sounds around you? What are some of the sounds you hear in this place you are imagining? How does the special place smell? Walk around a little and take in all the wonderful sights. Feel the air around you and relax. The air is fresh and it's easy to breathe here. Pay attention to how your body feels. Say to yourself, I'm totally relaxed, without worries. All the tension has drained away from my body. Take a moment to fully experience your favorite place. Notice the sounds, the sights, smell, and how it feels to be here in this very special place. Remember that you can visit this place as often as you want, and that is wonderful. Say to yourself, I'm relaxed here, this place is special and makes me feel at peace. When you're done with your visit to this special place, open your eyes and stay in your comfortable position. Continue to breathe smoothly in a relaxed and rhythmic fashion. Take as long as you want to enjoy and relax. Feel at ease, knowing your special place is always available to you, and find that you feel relaxed even after you leave. Breathe in deeply. There is a gentle breeze and the sun is shining. Big cotton-like clouds drift by as you hear seagulls in the distance. You taste traces of salt on your lips. You are completely relaxed. There are no worries on this beach. There is nothing to distract you from feeling tranquil. Worries drift away. Notice the sounds, sights, smells, and how it feels to be in this very special place. Feel the sand under your feet. You decide to stretch out on the warm, fine, white sand. Breathe deeply. Feel the warm air. Your body is completely relaxed and you have an overall feeling of warmth and comfort. You look up at the clouds pass by slowly across the beautiful blue sky. You are feeling rejuvenated and completely at peace. Remember that you can visit this place as often as you want, and that is wonderful. Say to yourself, I'm relaxed here. This place is special and makes me feel peaceful and content. When you are done with your visit, open your eyes and stay in your comfortable position. Continue to breathe smoothly in a relaxed and rhythmic fashion. Take as long as you want to enjoy and relax. You feel at ease knowing your special place is always available to you, and you find that you feel relaxed even after you leave. Ending treatment and maintaining changes. What is ending treatment and why is it important to plan for it? End of treatment planning is the collaborative process of preparing the patient and assessing his or her readiness for ending treatment and moving beyond reliance on the therapist to apply skills. Planning allows the patient to prepare for the end of treatment, to review skills learned in treatment, and to vocalize and problem-solve concerns about functioning outside treatment. All these factors reduce anxiety and allay fears a patient might have about ending a therapeutic relationship. Troubleshooting end of treatment. Give yourself adequate time to end treatment. Plan on an entire session devoted to ending treatment, wrapping up and maintaining changes. It is highly recommended that you not introduce new concepts during the final session, as new issues may arise, and ending treatment during the session may become impossible. Give the patient credit. Depressed or anxious patients often attribute positive change to external entities and negative change to themselves. Therefore, at the end of the treatment, discuss the patient's progress using objective data such as symptom rating scales when available, praise the patient, and emphasize his or her role in positive changes. Respond to concerns. Checking in with the patient regularly about questions or concerns about ending treatment helps maintain the therapeutic relationship and offset negative emotions about treatment that could result in negative outcomes such as feeling abandoned. If the patient seems particularly concerned about ending treatment, he or she could use a thought record to identify and challenge dysfunctional thoughts associated with leaving therapy. Plan self-management time. Patients may be interested in planning self-management time when preparing for the end of treatment. Self-management times are a few minutes each week that the patient sets aside once therapy is complete to check mood and use of skills in problem-solved situations or feelings that may be negatively affecting their mood. These times last approximately 10 to 15 minutes and follow a structure similar to therapy. Self-management time is beneficial because it is free, can be conducted at and when and where it is convenient for the patient, and helps prevent relapse. A self-management worksheet may be used during these times.